So help me welcome my boss, Dr. Uchenna Onoh. I know you don't know him. He can teach you everything. He can teach you Eng, Maths, Biochemistry, English, Maths, Biology, Chemistry, and Physics. Please, but I think you'll be handling that special aspect of his specialty, the cardiovascular system. I know you're going to listen and get something. Is that okay? So don't distract. I'm a candidate for the class, so I'm learning too. Thank you, sir.
Yeah, thank you. This place has upgraded. We have moved from that dilapidated structure down to this very one, and we also have a public address system. Not the other days that I used to shout, and it affects my vocal cord. So, without wasting your time, I don't know what that man said. All I know is that I didn't discover anything. It's the book that you people are reading that I read and I learned from it. I just want to share you people that I didn't discover anything. Where is the marker? So we are going to discuss the human circulatory system. That's the cardiovascular system. So, yeah, he said I should come and do it. I'm not a regular person here. Do you get that? My business is human body. I'm not a teacher. I'm not a teacher. I need marker. So the human, I can see myself, sir. The human circulatory system. You know, just as you know, the basic and the functional unit of life is cell, is it not? And as the cell come together to form tissue, organ, and system, now that means that there are some organisms that exist at cellular level. They are only at cellular level. They don't need circulatory system. Like amoeba. What they need is diffusion. Is it not? They need diffusion. So they don't need circulatory system. But as an organism becomes more complex, I'll not stay there. I'll be moving around to give you the preaching. As the organism becomes more complex, the organism will need the circulatory system that will be coordinated. Do you get that? You know the theory of evolution, how they evolved, because I know I did not evolve. On the sixth day, God made me in his image and likeness. But those that evolved, they said that we have the invertebrate and what? Vertebrate. They said that the least of among them is the species. From species to amphibians, from amphibians to reptiles, then to aves and to what? Mammal. That is how complex the circulatory system evolutes. Because one has only 2-chamber heart. At a point, one have 3-chamber hearts. Then we have the 4-chamber heart. So the human is actually a mammal. So whatever we say for the human is similar thing for all mammals. Is it not so? So we can say that the topic is, we can say is the circulatory system of mammals. Circulatory system of mammals. Please pay attention. You just need to listen to me and write it the way you understand it. Do you get the thing? If it is about what I'll be writing on the board, I am sorry for you. Because I've been a doctor for 14 years. So, I don't know. So, I don't know how to write very well again. It's not by our making. Our brain works faster than our hand. That's the reason. When all of those of you that wants to be, when you become one, you see what I'm telling you. So, the circulatory system has 3 components. I usually make it simple. The circulatory system of mammals has how many components? 3 components. We have the one component is the pump. We have the pump. The second component is the passage. We have the passage. And the third component is the passenger. Do you get that? That's how you understand the human circulatory system. Because the function of this system is to distribute nutrients And then to carry waste product, that's a function. It takes nutrient to where it is needed. Nutrient, I mean, is food, oxygen, and other things. Then it carries waste product from where it is produced to where it will be what? Excreted. So that's why I said what? Passenger. Then there is a passage, a pathway through which this thing flows. Circulatory means that it goes back to where it does what? It started. That's circulatory, like a circle, is it not? So the pump is actually the heart. That's what does the work of the pump. Then the passage. We have the passages. The passages are what we call blood vessels. They are the passages. And they are what we call lymphatics or lymphatic vessel. The blood vessels are artery, vein, and capillary. Do you get that? Then you see, I am used to blood. I'm a surgeon. That's why I choose red. I love it. Then now this is the lymphatic, the passage, blood vessel and the lymphatic vessel. Then we now have the passenger. What is being carried? The passenger is blood and lymph. That is what is carried by the circulatory system. So, let me take it again. The human circulatory system, or the circulatory system of mammals, has basically three components. Pump. In fact, there are 3 P's. You can say they are what? 3 P's to remember it. That's what we use in medicine, because you have a lot of things to memorize. So we use acronyms and mnemonics to remember things. So the 3 P's: pump, passage, and what? Passenger. We say that the pump is the heart, the passage are the blood vessels and the lymphatic vessels, and the blood vessels, you have the artery, the vein, and the what? Capillary. And the passenger is the blood and the lymph, and whatever they contain. You get that? So we go with the first one, which is the heart. The mammalian heart is divided into 4 chambers. It has how many chambers? 4. It has 4 chambers. And those 4 chambers are grouped into left and what? Right side. The 4 chambers are grouped into right and left side. So I'm going to make a drawing. May God help me to draw. So I will make a drawing like this. When we draw as if we don't know what we are drawing. But by the end of the day, we'll draw something. So there is a valve here. There's another valve here. So this is a schematic representation of human heart. You get it? Or mammalian heart. I say it has how many chambers? 4. 1, 2, 3, 4. Are you with me? And they are divided into 2. Let us assume this is the right side and this is the what? The left side. Those chambers. So each side has how many? 2. Is it not? 2 on this side, 2 on this side. So this one is known as the right atrium. This chamber is what? Right atrium. This one is the right ventricle. Very good. So this will be the left atrium and the left ventricle. Very good. These are the 4 chambers. Then, in a normal heart, there is no direct communication between these 2 chambers. But when they say that somebody has a hole in the heart, there may be a communication here. Do you get that? There may be another communication here. You said there is a hole in the heart. So now let's continue. Then we go further and say that the right heart, the right part of the heart. When I say right part of the heart, What I mean is the right ventricle and the right atrium. Two of them. This board is dancing. I don't know who is singing the music that the board is dancing, but it's actually swinging the waist like that girl laughing at the back. She knows herself, you know, and she has stopped laughing. Now, I said the right part of the heart is responsible for deoxygenated what? Blood. So right part deals with what? Deoxygenated blood. When you see DE attached to something, that means removal of that thing. So deoxygenated means that oxygen has been removed from it. Do you get that? You know what is a hydrate? What is a hydrate? Water. Water is hydrate. So when somebody is dehydrated, that means that water has gone out of the body, is it not? So the right part deals with deoxygenated blood. Then the left part deals with oxygenated blood. Very good. So look at how it works. Let us see the pattern of flow. All the oxygenated blood from the body, except from the lungs. All blood which are deoxygenated that comes from the body, every part of the body, they find their way. The ones from the upper part of the body. Let us divide the body into the upper and what? Lower part. What divides the body into upper and lower part is a structure here, which we call diaphragm. Do you get that? Very good. So all the deoxygenated blood from upper part, that's above the diaphragm, they find their way, directly or indirectly, into superior vena cava. Do you get that? They find their way, directly or indirectly, into the what? Superior vena cava. Now, those from the lower part of the body, that is below the diaphragm, they find their way into what? Inferior vena cava. Superior means up. Inferior means below. It's not a big deal. Two of them are vena cava. But one is up, and the other one is what? Below. The one up is what? Superior. Like if I want to talk about my boss, I will say my superior. My superior said I should stop this lecture. Then my inferior must come and listen to this lecture. Do you get that? So that is it. So the superior vena cava and inferior vena cava, they collect all the blood and they will channel it into where? Into the right atrium. Do you get that? So if I open your right atrium, what I will see is a deoxygenated what? Blood. And the source of this deoxygenated blood is from the superior vena cava and the what? Inferior vena cava. Now, they are veins, so then from the right atrium, the blood passes. You can see I made an arrow like this. What is this? It's a valve. A valve allows one-way flow. Do you get that? It allows one-way flow. It doesn't allow backward flow. You see, that's why I channel it this way. So the blood moves from the right atrium into the what? Right ventricle. You see, this, you just be making the point. Each statement I make, you write it. The blood moves from right atrium into the right ventricle through a valve. And the name of that valve, so the name of this valve is tricuspid. Do you get that? It's what? Tricuspid. Do you know the meaning of triangle? Yes. It has how many angles? Three. So tricuspid means that it has three cusps. This guy, it has three cusps. So that's why it's called what? Tricuspid valve. So the valve that sits between the right atrium and the right ventricle is what? Tricuspid valve. Now, from the right ventricle, the blood goes into the pulmonary artery. So this is pulmonary artery. Whenever you hear pulmonary, what does it imply? The lungs. Very good. It flows into the pulmonary artery. So from the pulmonary artery, so there is another valve lying between the right ventricle and the pulmonary artery. That valve is known as pulmonary valve. They called it what? Pulmonary valve. How many valves have I mentioned now? And these two are situated where? On the right part of the heart. Very good. So, that's the pulmonary artery. So from the right ventricle, it enters into the pulmonary artery. From the pulmonary artery, where will it go to? It will go to the lungs. What happens in the lungs? You go to the lungs. For what? Oxygenation. Remember I told you that the blood or this part, they are what? Deoxygenated. Is it not? So they need to be oxygenated because what your body needs is what? Oxygen. Is it not? So the superior vena cava and the inferior vena cava, they gather the deoxygenated blood, push it to the right atrium. From the right atrium, it passes through the tricuspid valve, enters into the right ventricle. From the right ventricle, it passes through the pulmonary valve, enters into the pulmonary artery. From the pulmonary artery, it gets to the lungs. For what? Oxygenation. Full stop. So after oxygenation in the lungs, so let us carry this lung here. Let us carry the lung here. After being oxygenated in the lungs, it will not go back to the right part of the heart. Where will it go back to? It will go back to the left. So there are veins we call pulmonary vein. Do you get that? They are the counterparts of pulmonary artery. Do you get that? What type of blood flows through pulmonary artery? Deoxygenated. Deoxygenated. Now when it gets to the lungs, it gets what? After the oxygenated, the lung will gather all of them. Both lungs. You have two lungs. The lungs will gather them, channel them into 4 pulmonary veins. How many are they? 4 pulmonary veins. 2 from the right lung and 2 from the what? Left lung. The 4 will find their way into the left atrium. Into where? Into the left atrium. So the 4 pulmonary veins empties into where? Into the left atrium. What type of blood do they carry? They carry oxygenated blood. They will empty all the oxygenated blood into where? Into the left atrium. Now, so when the blood gets here, okay, let's use a better schema. Gary. So the very red ones. So when the blood that has been oxygenated from the lungs, what gathers it is what? The pulmonary veins. It will come into where? Into the left atrium. Then it will pass through a valve. This is the 3rd valve I'm mentioning here. It will pass through a valve into the left ventricle. So this valve it passed through is called bicuspid valve because it has 2 coops, unlike the other one that has what? 3. Is that okay? So it will pass through it into the left what? Ventricle. Into the left ventricle. Now, the left ventricle does the major work. What did I say? The left ventricle does the major work. When they say that somebody has heart failure, it's actually the left ventricle that fails. Do you get that? Somebody can survive without other chambers of the heart, but you cannot survive without the left ventricle. The left ventricle must be working for you to survive because it does most of the work. Do you get that? So the left ventricle is a powerful structure in the heart. It has a very good muscle mass, so it pumps the blood from here into the aorta. This is a very big, important, the largest the largest artery in human body is what? Aorta. What did I say it is? Not aorta, aorta. A-O-R-T-A. So the left ventricle pumps blood into the largest artery in the mammal. And that artery is known as what? Aorta. There is a valve here. What do we say that this valve is? Pulmonary valve. Into what? Pulmonary artery. Now, there's another valve here into the aorta. So what are we going to call it? Aortic valve. So here is the aortic what? Valve. Now, both aortic valve and pulmonary valve, both of them are known as semi-lunar valve because they look like half moon. Semi-lunar valve. The lunar means what? Moon. It has to do with moon. So when two of them, they are collectively called semi-lunar valve. The one that is positioned in the entrance of the pulmonary artery is called pulmonary valve. The other one is called the aortic valve. Is it not? So how many valves does the heart have? That's what you should know. Actually, the heart has 6 valves. But when you come into cardiothoracic surgery, you know the 2 other valves. But here, they say you should only know 4. That is one funny thing. Nothing is limited. As you go, you keep on knowing. Because that Obi that was a boy will never remain a boy. That Obi that was a boy during our primary school is now a grandfather. Do you get that? So, yeah, 4 valves and 4 chambers. Good. So the aorta, every artery originates from the aorta, directly or what? Indirectly. Do you get that? So that is it. So from the aorta, the blood gets to all parts of the body. When you feel your pulse, we usually feel pulse here. When you touch here, your wrist, you see the pulsation. That pulsation is the what? Is the heartbeat. Is the way the heart is pumping the blood in a pulsatile manner. It's pumping it. That's what you do, what you feel. So that's why when you want to check if somebody is dead, you go and look for the what? For the pulse. Is it not? Very good. Without pulse, you cannot get blood pressure. What gives blood pressure is the what? The heart. Once the heart is no longer working, the blood will not have pressure. Do you get that? Because this is just like the water system in your house. When you live in a flat, you turn the shower, it will do va because it has what? Pressure. And it gets that pressure when you have an overhead what? Tank. Do you get that? Because the tank is at a higher level. Because you say that pressure is height times density times what? Like, so, what is pressure now? Height times what? There's another pressure, not what? No, this is chorus answer. I just drag you people from biology to physics now, and you people are all confused. Confusion. It's okay, don't worry about that. We'll talk about that on a physics day. This is biology day. But what I'm telling you is, it's okay. You say the heart gives pressure to the blood. You see where the heart is located. I don't know where your own is located. Some people have their heart on their anus. Do you get that? But mine is here. This is the anatomical location of the heart. And you see where the brain is. If the heart doesn't give the blood pressure, blood will not be able to get here. Do you get the thing? That is why when the pressure drops, the person will do what? Will faint. The person will collapse and lie what? Flat. Do you get that? When the person now lies flat, there is no more gravity between the brain and the heart. The person will wake up. It's not the water you poured on the person that makes the person to wake up. It's just that the blood flows to the heart, to the brain again. So fainting is a survival mechanism through which the brain survives. If the brain fails to get oxygen, it will quietly shut down. And what follows it is that you fall down. When you now fall down, your heart and the brain will be on the same level. Do you get that? And when when it's now on the same level, the blood can easily do what? Flow, and the brain will wake up. So that's by the way. So we have dealt with the pump. Now let us go to the what? To the passages. We said that the passages are what? Blood vessels. So let us rattle through the blood vessels within 5 minutes. I will leave this schema for those of you that are not here. They can come and look at it later. So I will only be cleaning this place. But if my brain kind of shut down and I want to clean here, you remind me. Do you get that? Very good. This, their face, Marie board there. You have to fix it. If I come next time and the board is dancing, I will dance with the board. Now, the vessels. We said that the vessels are what? Blood vessels. Eh? Then we have the artery. Eh? And we have what? Vein. So, and we have capillary. Now let us start with capillary. Capillary is the region of exchange between the artery and the vein. That is where the artery and the vein exchange their contents. Do you get that? Capillary, region of exchange between artery and vein, and between the circulatory system and cell. So, you know, when you get a cell and cut in through the cell, you will not see blood inside the cell. Do you get it? What you see is water and other material. So at that capillary level, the cells gives the blood waste product. Do you get that? And then collects what? Nutrients from the blood. So capillary is the interface between the circulatory system and the body cells. Do you get that? Very good. So we have dealt with the capillary. So the major thing is the artery and what? Vein. We are going to compare them in a tabular form. We compare the two in a tabular form. So we have artery and we have what? Vein. So we will write about them in a tabular form. The first point is that the artery carries oxygenated blood away from heart. But there is an exception. The exception is who? The pulmonary artery. Very good. That's the exception. That's what they usually tell us from the time of integrated science. Do they still do integrated science in junior class? Yes. They call it basic. That integrated science is integration of pure sciences. What makes up pure sciences, young lady? Biology, chemistry, and what? Physics. That is the pure sciences. Then every other thing is what? Applied science. Like medicine is what? Applied science. We apply the basic principles of biology, chemistry, and physics. Not just that. Is it not? Very good. So, artery carries oxygenated blood away from the heart, except pulmonary artery. Vein carries deoxygenated blood towards the heart, except pulmonary vein. Because remember we told you here that pulmonary veins, they carry what? Oxygenated. But in here we told you that the pulmonary artery carries deoxygenated. Then number 2, artery has thick wall. It has what? Please, that girl in white, write the names of noisemakers at the back. They will pay 500 naira for my fuel. Thick wall. Then this one has thin wall. Then the third thing is smaller lumen. It has what? Smaller lumen. Lumen means the cavity. I've used my hand to form a lumen. This is the lumen. Cavity. Then this one has a bigger lumen. Then, I said you listen to me. Those things you can spell it yourself. Please pay attention. Pay attention. Yeah, I have the questions, but these questions are better answered in my consulting room when you pay for consultation fee. Now, please pay attention. The fourth comparison is no valves. Arteries, they don't have what? Valves. Lumen. I said lumen is the inside, the cavity. You have hose in your house using fetching water. Inside of it is the lumen. So the arteries, they don't usually have what? Valves. But vein does what? Some vein has valves. Not all vein. There are some that doesn't have valve. Should I go on? The fifth comparison, at least in everything you should know about 5. Whenever they ask something, you know about 5. So we stop at 5. We can keep on comparing. But 5, the 15 is that this one pulsates. Arteries does what? Pulsates. It pulsates, it means boom, 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 boom. Do you get that? There's one artery that usually be here. You just be feeling boom, boom. Especially when you have headache. Do you get that? Whenever we see a vessel, when we operate on human being, we feel it. If it's pulsating, we say this one is what? Artery. If it's not pulsating, we say it's what? Vein. So this one pulsates. So there is no pulsation. Is that okay? That's about the blood vessel. Then the other passage. What's the other passage? When I was giving the schema. Lymphatics. Now let me tell you one thing. Have you ever seen somebody that the leg is swollen? The 2 legs are swollen. If I look at the legs here, I must find somebody that his or hers, especially hers, that is swollen. Do you know why the leg is swollen? Do you know why? I just want to know how far people see what I'm writing. Sorry about that, young man. Do you know why the leg is swollen? The principle is that the amount of blood that is supplied to an organ should also be the amount of blood that is collected from it. What supplies the blood? The artery. The artery supplies the blood, and then the vein does what? Carries it back. Do you get that? We want to talk about the lymphatic vessels, what they do, the lymphatics. But, you know, just like every other machine, the human being is a machine created by God. There is no 100% efficiency. So you cannot guarantee that the total amount of blood supplied by the artery, that the vein will collect all of them. There is going to be what? Some remnants. So the lymphatic system is that system that returns the remaining blood, the remaining fluid that the veins could not return. Do you get that? So God created that one as a reserve. Because if what is supplied is not collected, there's going to be damping. So in those situations whereby you see the leg of your grandmother swelling, that means that the amount of blood supplied to the leg is not doing what? Collected. Some are still doing what? Remaining. And it's even too big for the lymphatic to collect them. So, I repeat it again. We are talking about the lymphatics. The lymphatic system is a system that returns fluids that the venous system cannot return. Or the venous system failed to do what? Return. So that's what we call lymphatic vessels. Sorry, I didn't prepare for this lecture. I would have prepared a PowerPoint for this lecture, because you people are no longer in secondary school. You cannot go back to secondary school. You should be treated as people in the world, university, because that's where you are heading to, isn't it? I will repeat it. I said, look at those people in the front. Just because I went to the back, they have started quarreling. Huh? Do you people sleep here to get the front seat? Now, I said that the lymphatic system is a system that returns the fluids that the venous system fails to return. Do you get that? Is it venous, vein, venous, venous. We have the arterial system, the venous system, and the lymphatic system. Just don't worry about what we call it. Just know that this the simple thing is that this is the body part. The artery supplies what? The blood. And the vein does what? Carry it back. But the vein does not carry all of them back. Do you get that? What is remaining after the vein has carried is now carried by what? Lymphatics. Full stop. If the lymphatic fails to work, the body will start doing what? Swelling. Do you get the thing now? Good. So, do you get that now? But what we get in lymphatic is not blood. What lymphatic system carries is not what? Blood. What it carries is what? Lymph. What does it carry? Lymph. Very good. It's called what? Lymph. You know, we are still in passage. We still enter into what? Passenger. So the passenger of lymphatic system is lymph. Look at it here. Lymph. It's from the word the lymph. They get what? Lymphatic. Do you get that? Have you ever had wound on your leg and you now feel something here that pains you? That thing you feel here that pains you is called lymph node. It's called what? Lymph nodes. Do you get that? Because the wound is infected. Because the wound is infected, that's what makes the lymph node to do what? To enlarge. Do you get that? I'll tell you about the lymph node later. So we now progress to the last part of the lecture, which is the what? The passenger. We progress to the passenger. Because we have talked about the pump, which is the heart, that has 4 chambers and 4 valves that is divided into right and left. That the right is responsible for deoxygenated blood and the left is responsible for what? Oxygenated. Full stop. And we have talked about the passage, which includes the arteries and the what? Vein. And what? Capillary. And we said that the capillary is the interface between the circulatory system and the cells. We also compare the arteries and the vein, just as shown here. I've summarized so far. Haven't I done that? Very good. Now, we move ahead to what? Passengers. Yeah, very good. Passengers. In fact, today has been a day of talking because just coming out from the clinic, I've been talking with medical students. Some of them were sitting down here about 4 years ago, but they're now in 40 years. So that's how you are going to be in 40 years. In the next 4 years, and you see me in the clinic, and you say, I remember this man. Maybe by that time, my hair will already be very white. It's turning white. Guys, you're a young man. I look at the young ladies you are flocking around. I bet you're going to get old one day. You get So you work hard for your old age. So now, the passengers. The passengers are blood and what? Lymph. So let us talk about blood. Because your Bible said that without the shedding of blood, there will be no remission of sins. Without the shedding of blood, there will be no remission of sins. So let us talk about blood. Blood that is thicker than water. Let us talk about blood. Obara. I know there are some vampires here. They, they move around at night. But Holy Ghost will fire them one day. For those of you that want to suck my own blood, for your information, my own is not sweet. It's very bitter and poisonous. So let us study blood. There is a branch of medicine that deals with the study of blood. What is it called? Okay, we talked about hearts. Yeah? I know this man. Did you attend CIC? Okay, that means I don't know you. Who is from CIC here? CIC, raise your hand up. Sempe? Yeah. I finished in CIC in 2002. So, okay, they are in the other class. Very good. If there's any CIC guy here, you come and meet me after, so I'll give you money for transport. And when we were in CIC, well, that's by the way. So we are talking about blood. We talked about heart. So the branch of medicine that deals with heart is cardiology. Do you get that? Now we're going to talk about blood. Blood means hem. Whenever you hear hem, means what? Blood. So you usually hear about hemorrhage, which is what? Bleeding. Eh? Then you hear about hemophilia, which is somebody that is prone to bleeding. You hear hemostasis, which is stopping bleeding. Do you get that? Hemostasis means stopping bleeding. Hemostasis means stop, static. Do you get that? So, who can now tell me what the study of blood is? Branch of it's not hemology. You tried hematology. Very good, hematology. We used to have hematology lectures that in that block there when we were in 4th year, hematology. So that's blood. So the blood, as we know, is made up of cells and plasma. I said blood is made up of what? Cells and so blood is a tissue. Is a tissue. A tissue that's composed of what? Cells and what? Plasma. Plasma is the liquid portion of blood. Do you get that? So let us start with the plasma. Plasma has water. It has water. It has a lot of things. Plasma contains a lot of things. There is water. There are salts. Those salts are called minerals. Either you call it salt or you call it what? Minerals. Or even ions. You people know about ions. In the blood, we have sodium ion, potassium ion, calcium ion, chloride ion, phosphate ion, bicarbonate. It also has proteins, glucose, hormones, do you get that? And even some oxygen. The plasma contains some oxygen. And etc. I cannot name all of them. A lot of things are inside the what? Plasma. These are the major things in the plasma. Is it okay? I should bring you closer. I don't want to touch my lips, you know. Very good. Now, there are also what we call coagulation factors. The thing that helps the blood to do what? To coagulate. They are found inside plasma. So coagulation factors. Now there's what we call, from plasma you can get serum. What they call what? Serum. The serum and plasma, they are mainly the same thing, except that serum has no coagulation factor. Do you get that? So when you remove coagulation factors from plasma, what do you get? Serum. Very good, you've known that one. Then let us go to the cells. The blood cells. These are the passengers now. Let's go to the blood cells. Are you with us? The fair lady, you are with us? Very good, you're a good child of God. I know you very well. I see you in the spirit. I usually watch you people in Facebook. You do a lot of prayers, a lot of spiritual battle. You know? Because we are not battling against flesh and blood, but against principalities. Very good. Yeah. So let's talk about the blood cells. Basically, we have three blood cells. Some of them are not cells in the real sense. They are not what? They are not cells in the real sense. But we can just be calling them cells. Do you get that? You will see why they are not cells in the real sense. Or you have not taken this one. There is something that is, let me tell you one thing. There's something that is written at the back of every teacher. Do you know what is written at the back of every teacher? Make noise. Because whenever the teacher turns back, you start making noise. Because something is written there that says, make noise. Now, the blood cells are one. Red blood cells. Number 2, white blood cells. Number 3, platelets. Now, let's see. The red blood cells, when you say that something is erythematous, that means it's reddish. Like if I slap this fair lady now, the cheek will become what? Red. Yeah? The doctor will describe it as being erythematous. So, what are we going to call red blood cell? Erythrocyte. Very good. Because erythro means what? Red. Anytime you hear cyte, it means what? Cell. So what is the study of cells? Cytology. Very good. There are many logi in medicine. Medicine is a stupid thing that is full of what? Logies. They have cytology, they have histology. Even oncoquology, zoology. Leuco means white. So we call this one the leukocytes. Then the thrombocytes, because they perform in thrombosis. Thrombosis means coagulation, because there are cells that partake in blood coagulation. That's why they call it what? Thrombocytes. These are how things are formed. Of all the things created by God, God did not give anyone name. What name did the things God created? Man. That's what your Bible said. So it's when man looks at the behavior of something, they will not give it what? Name. That's why they give you Chukwuemeka. Is it not your name? It's not your name. That means I'm a fake pastor. So, the thrombocytes. Now, let's go on. The erythrocytes, they lack nucleus. So, let us start with the red blood cell. Red blood cell, no nucleus. They don't have nucleus. They are basically called they have what we call capsules. They don't have nucleus, no definite shape, no definite shape. So can transform to pass that person talking, to pass through openings. Then that's red blood cell has hemoglobin. It has what? Hemoglobin, which binds and transports oxygen. Which binds and does what? Transport oxygen. Reduction in red blood cell is called anemia. When they say you are anemic, that means your red blood cell is what? Low. Too much red blood cell is called polycythemia. So this is about red blood cell. Where is it produced? It's produced in the bone marrow. It's produced where? In the bone marrow. Produced in the bone marrow. Very good. That's about red blood cells. They don't have nucleus per se. They just have capsules. They are like a disc. Yes, has a disc shape, sort of. So we can say disc shape, sort of, like a disc. Very good. Now, we have the white blood cells, WBC. WBC, the white blood cells. So what is the work of the red blood cell? Transportation of what? Oxygen. Through the help of what? Hemoglobin. I'm not cleaning this one. Only this one. No, there's no time. I'm going to music. We have music. We have a good mom in our village. I'm going there now. There's somebody I'm looking for that's supposed to be here. Does it mean that she doesn't come to lesson? If you know that you are the one I'm looking for, better identify before I tell your mother that you don't come to lesson. Better raise your hand though. It's a female. Not this. Not. Where are you? You want me to call your name? You better stand up and show yourself. Because I'm going home straight to your mother. So tell her that you don't come to. Stand up wherever you are and show yourself. The white blood cells, as we know, they told you that it fights against what? No, you can't get it to go down. You are doing well. They say it fights against diseases, is it not? Well, I don't know. We can keep on saying that. It enhances the immune system. It's for immune system. Do you know that we also study immune system in medicine? What is it called? Immunology. It's so versatile. Yeah? That's why. What's that? Those people are, just make sure that the person is okay. Because the brain may not be getting enough oxygen. I forgot to tell you, before the brain faints, it can start talking nonsense. You know that there is issues. So white blood cells, essential for what? Immunity. Immunity. Essential for immunity. That is what you mean by defense mechanism. Yeah? But white blood cell has many subcomponents. It has what? Many subcomponents. So it's a cell. It has nucleus. It has nucleus. Normal, indefinite shape of animal cell. Of animal cell. Do you get that? So it has subtypes. It has subtypes. Pay attention now. It has there's one we call neutrophil. Neutrophil. There's one they call monocytes. There's one they call eosinophil. There is one they call basophil. I will tell you what they mean. There is the one they call lymphocytes. I hope you have heard about lymph today. You now have lymphocytes. What does your mind tell you? The lymphocytes will have to do with what? Lymphatic system. Is it not? Very good. Very good. Very good. So, let me tell you, forget about those, the lymphocytes, they are found in the lymphatic system and lymph nodes. Do you get that? Now, neutrophil. Phil means attraction. Do you get that? Like Theophilus means somebody that loves God. Because God is what? Theo. So what's the study of God? Theology. Very good. Yeah? Now, you see, it now have Philomena. I don't know the meaning of that one, but I know it has to do with that. So this neutrophil, what do we have? The basic substances we have is either you are water, and water is what? Neutral, is it not? Or you are acid, or you are what? Base. So those cells, they have started making a noise at the back again. Those cells that does not react to acid or base, they are what? Neutrophil. Means they are neutral. Neutral phil. Do you get that? The ones that react to acid are the what? Eosinophil. And the ones that react to base are what? The basophils. That's just that. These are the sub-classifications of white blood cell. The essence of the white blood cell is for what? Immunity. Now, what is immunity? What is immunity? Somebody from the back. Answer it for 500. Okay, let's make it 1,000 for your break and your transport. If 1,000 naira is nothing now, 5,000. Oh yeah, what's immunity? Please pay attention. Tell us now, what's immunity? He said it helps. Yes, you have the idea, but actually, immunity is, that is the word I want. Ability of the body to do what? To fight disease-causing organism. So, I said 5,000, but I didn't mention the currency. Whether it is naira or kobo. So it's 5,000. Now divide 5,000 by 100. Let us know what is in kobo. It's 50 naira. Very good. Let I come and correct you 15 naira. What I actually mean is 5,000 kobo. So whenever I say 5,000, you should ask me which one. Is it 5,000 naira or 5,000 kobo? Eh? Very good. So the last one, the last of the blood cells is the what? The platelets. What's the other name for platelets? Yeah? Thrombocytes. It's not a cell. They are particles. Thrombocytes, that's the platelet. They are not cell in the sense because they don't have nucleus. This is what you see in your OBJ. They will just write thrombocytes. A has nucleus. B does this. C does that. Do you get that? So know that the thrombocytes are particles. They originate from a cell. So they break off from a cell. They actually break off from a cell. Let me tell you, there is a cell that we call megakaryocyte. Mega means big. Look at the cell. It's a very big cell. It has everything that a cell used to have. So from that megakaryocyte, some things will be breaking off. Those things that break off are the what? Platelets. Anytime you see lets, that means it's a smaller portion of big. Like what? Piglets. When they say piglets, that means is the children of what? Pigs. Do you get that? Very good. So the word platelets means that they originated from a smaller plate that originated from a bigger plate. So that big plate is what? Megakaryocyte that gives rise to what? Platelet. So the platelets, there is no nucleus. Do you get that? Their function is in what? Blood coagulation. Blood what? Coagulation. If you don't have platelets, if I cut you, you keep on bleeding till you die. But because you have enough platelets, when they cut you, you bleed a little, then coagulation will come and do what? Seal it up. Is it not so? So I've told you about the lymph. The lymph is what flows through the what? Lymphatic. It is the remnant of the fluid that is supplied to an organ. Do you get that? There's something I omitted because my time is up. Why hasn't my phone rang since? Are you sure that this phone is not off? Or you people use your janja, your kampurumus to make the phone not to ring? Because it's okay. Thank God that never. That means I'm not disappointing anybody. So let's go on. So I have some questions here that I'll answer before I go. When next I come, I'll take any other question. Or whenever you see me in your university classroom. Well, those of you that will do medicine in UNTH, you must see me. If you don't see me on a normal day, you see me during the examination. And if I don't like your face, I will fail you. You gotta repeat. So there are some special vessels. So write it as a subtopic, special vessels. There are some special vessels. Some special vessels in the mammalian body, you must know their names. I'm going to make a table. Then you will complete the table yourself. I'm going to put an organ. The topic is special vessels. Then I'll put here organ, the artery, and the what? Vein. And then I'll draw it this way, and I'll put it this way, and I'll put it this way. So because I have the luxury of markers, let me keep those questions here. I have the luxury of markers. Let us say brain, the arteries are known as carotid. It is the carotid that supplies the brain. I don't know why they are called carotid. Then the veins that drains the carotid is jugular. So we move from the brain. The brain is a special organ, isn't it? In fact, it's the most important organ. We now have the heart. Do you know, even though the heart is the pump, the heart is supplied to blood vessels. The heart pumps blood to itself. Do you get this? Let me tell you, if you have borehole in your house and you are supplying the people in your street, would you supply yourself? Yes. So the heart, in fact, the first branch that leaves the heart supplies the what? The heart. And is known as coronary. 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 So the vein that drains the heart is known as, this one is known as coronary artery. The vein that drains the heart is known as coronary sinus. They don't call it vein, they call it sinus. Eh? Very good. You have known about the pulmonary, the lungs. Eh? Lung is supplied by pulmonary artery. Why am I writing it with blue? Because it carries deoxygenated blood. But it's drained by what? Pulmonary vein. Do you get that? Which other important structure in the body? We have the liver. The liver. The liver. Liver is very important. Hepatic artery. Then we have the hepatic vein. Then the liver is also supplied by what we call hepatic portal vein. Do you get that? It's also supplied by hepatic portal vein. This hepatic portal vein is a very special type of vein. It carries, let us talk about hepatic portal vein. Do you get that? No, I'm not going to waste your time. I know some of you worldish ones, you mundane ones. You have appointments with your boyfriend. Okay, I know that's where you want to go. You mundane ones. So the Christian ones, the child of God ones, they are not making a noise. Those people are making a noise at the mundane. I'm not wasting your time. I'm sorry I came late. I went to work where I earn my living. Do you get that? Felix cannot pay me. I'm a consultant. He can't pay me. If he can pay me up to 2 million every week, I will come and be teaching you people. But he can't. You cannot generate that. Up to 5,000 again and go about. Yeah? So now listen. I will not waste your time. Next 5 minutes, I'm gone. I'm even tired. Okay. So the hepatic portal vein, it's not a, I just want to tell you that it carries digested food. It carries digested food from the gastrointestinal tract, from the digestive system. Hepatic portal vein carries digested food from the digestive system to the liver. It carries digested food from the digestive system to the liver. This is sabotage. It's sabotage. You have generator. Or is it generator that went off? I told you that witchcraft is real. and you don't believe, if you like, on the exam day, don't pray and go to exam. They will be looking for your own answer script. Yeah? Okay, just 1 minute. 1 minute. You guy, that guy there. Yeah, 1 minute. 1 minute, I'm done. You, yeah, you. You that is wearing green. Is it Nigerian jersey? Yeah, you. Stand up there. 1 minute, I'm done. You hear? So, the hepatic portal vein, I say, carries digested food material from digestive system to the liver. It's a special type of vein because it begins from capillary and ends in capillary. Do you get that? Hello? Can you hear me now? Very good. Thank you for not hearing me. You know, they don't use hearing as a present continuous tense. So you don't say I'm not hearing you. It's a wrong English. You just say I can't hear you. So I said that hepatic portal vein is a special type of vein because it begins from capillary and ends in capillary. Look at it. Arteries originate from the heart. Arteries does not start from capillary. Artery originates from the heart and ends in capillary. Do you get that? Then veins begins from capillaries and ends in where? Heart. Do you get the thing? Do you get the gist now? Listen and listen. This is my last statement here. And that last statement is that the arteries originate from where? The heart. And where do they terminate? In capillaries. Then that veins originate from where? Capillaries and ends in where? Heart. That's what I said. And I went further to tell you that hepatic portal vein is a special type of vein because it starts from the capillaries and ends in where? Capillary. Full stop. So your master will come and close the distance. So I have how many questions? I think it's only 2, or was it up to 3? Somebody said when the person was giving me this, I was thinking his phone number that she was giving me. I don't know. It's a question. Does it mean that those that has high blood pressure, their blood is being pumped faster? No. It doesn't mean. High blood pressure implies that, yes, look at it now. The blood that is flowing through your vessel is like a what? Current. What is current? Current is the flow of what? Electrons. When there is resistance to the flow of electrons, what do you have? Resistance. Is it not? Do you get that? If the resistance is high, the voltage will be what? Low. Ohm's law. Okay, very good. So high blood pressure implies that there is resistance to the flow of what? Blood. So the blood is now increasing the pressure to overcome such resistance. So it doesn't mean that the blood is being pumping faster. Uncle. Then in some situation, somebody said, is that why the abdomen is swelled up? When I was talking about leg swelling, in some people that have leg swelling, the abdomen will also swell. But let me tell you, anytime you see a swollen abdomen, there are 5 or 6 F's responsible for swollen abdomen. That abdomen that is swollen, like my own, if it is not fat, it is fluid, it is food, it is flatus, and it is fetus. These are the things that swell the abdomen. Flatus is arrow, gas. Do you get that? So the last question, this person says, what causes high blood pressure? The person should come to my consulting room and I will explain to her, because somebody wants to shoot me from the back. So you have a nice day.